So we know that Koreans are coming to our platform looking for health information. We continue to see, as we do see in other places, where people search for information to help them make the right decisions.
유튜브 본사에서 공중보건과 헬스 관련 콘텐츠 정책을 결정하는 총책임자인 가스 그레이엄 박사를 SBS가 만났습니다. 부시와 오바마 정부에서 약 7년간 미 보건부 차관보를 지낸 그는 2020년 유튜브에 합류했고 새로운 서비스 출시를 위해 한국을 찾았습니다. 그레이엄 박사는 자신이 유튜브에 합류했을 때는 코로나 팬데믹이라는 위기 상황이었다고 회상했습니다.
The biggest challenge was as the science was changing, as people were learning more about the pandemic, we had to make sure that we were able to reach communities with information around COVID that was reflective of what the public health authorities and leaders, both at the state, the local level and the global level, were trying to communicate.
무엇보다 백신 부작용에 대한 과도한 공포를 부추기거나 잘못된 치료법을 담은 영상들이 노출되지 않도록 하는 일이 중요했다고 말했습니다.
One thing I often say to people is we used to often talk about bench to bedside in science, meaning how long it took from you discovering a drug to being able to get it in the hospital. But the times have changed, and now it's about bench to couch or bench to your living room, meaning when that science has been developed to when you start to hear about it and understand it. And so as information changes and science changes, it's really important for not just us as a platform to elevate authoritative voices.
유튜브는 지난 2022년 병원이나 정부기관처럼 공신력이 있는 기관이 제작한 보건, 헬스 관련 영상 콘텐츠의 출처를 표시하는 서비스를 시작하고 이 기관들이 만든 영상을 검색 시 우선 노출되도록 알고리즘을 짰습니다. 지난해부터는 국내 의료기관들이 제작한 콘텐츠에도 공인 의료 서비스 제공자라는 출처를 표기했습니다.
And so certainly in a time where there is information that can come from different places, it's important for people to understand credible sources, sources that are authoritative in nature.
유튜브는 올해 상반기 중으로 이 서비스를 국내 개인 크리에이터들에게도 적용하기로 했습니다. 현재 신청을 받은 크리에이터들의 적정성 여부를 심사 중입니다. 크리에이터들이 혹시 유튜브 인증을 개인 병원이나 의료 제품 마케팅 수단으로 삼아 문제가 되면 어떻게 할 것인지 물었습니다.
We continue broadly to have creators disclose when they're getting that kind when there is that sponsorship or information that they're sharing with the public. The same so that we would require in terms of health information. One of the things they do is they attest to a set of principles that were created by the World Health Organization in accordance with some other doctors and clinicians on the US side and across the world. And one of those principles is that the information is both evidence-based, but also that the goal that they aspire towards is to deliver primarily evidence-based health information that's in the best interest of the patient.
크리에이터들이 이런 원칙을 준수하는지 지속적으로 살펴보겠다고 말했습니다.
With YouTube, and it's important for us to keep people safe. And so across 24/7, every day of the year, both people and our machines are working to maintain the safety on the platform. And we do that with health information, and we do that with other pieces of information. But on the health side, we use really a lot of what we understand about the science and the consensus on science to keep people safe.
모두의 관심사인 AI에 대해서도 물었습니다. 요즘 생성형 AI 기술을 활용해 제작된 유튜브 콘텐츠도 쉽게 찾아볼 수 있는데 그레이엄 박사는 이에 대해서도 대비하고 있다고 말했습니다.
Certainly, as the technology evolves, there are also challenges. And when we see things, particularly there's a lot of concern around synthetic information, the creation of health information. And we recently announced both efforts to make sure that creators disclose when they're using AI for synthetic information, and also how we're going to label that information so that users and consumers understand that. And we'll see that be visible here in Korea in the next couple of months.
그레이엄 박사는 지난 2022년 건강 관련 유튜브 영상 조회수가 한국에서만 35억 회에 달했다며 한국 콘텐츠에 대한 기대가 크다고 말했습니다.
Korea is in general, both particularly on the health side, we see a lot of innovation and creativity. And the ability to both learn from that and have others around the world learn from that helps us to improve, again, globally, how, particularly on the health side, we reach people with health information. This is why I'm here, and I think why YouTube cares so much about Korea is because
SBS
of the
홍효지입니다.
rapid way in which Korea continues to both